Welcome to the iPod, a new podcast series from Ophthalmology Times where we engage with key opinion leaders in interviews about the latest innovations in the areas of surgery, clinical diagnosis, drug therapy, research, technology, or practice management.
I'm David Hutton of Ophthalmology Times. The American Society of Cataract and Refractive Surgery is hosting a virtual annual meeting for 2020, and today I'm joined by Dr. Alice Epitropoulos, who presented image quality or depth of field, or both, clinical outcomes from spherical, aberration, neutral, monofocal, toric IOL. Thanks for joining us today. Tell us about your presentation.
Thanks, David. Well, I presented my outcomes with the Envista Toric, a single-piece toric IOL with an aspheric optic and zero spherical aberrations at the ASCRS virtual meeting. By preserving the cornea's natural positive spherical aberration, our patients can have sharper vision with the potential for increased depth of focus. This was a prospective single-site, single-surgeon case series. We looked at 40 consecutive eyes of 33 patients who received the Envista Toric lens. And we made sure that the ocular surface was optimized preoperatively as recommended by the ASCRS dry eye algorithm. Most eyes, 31 eyes, were targeted for distance, with 9 eyes targeted for monovision. And we found it interesting that most eyes targeted for distance were able to see very well at distance. They were also able to see 20/25 or better at intermediate and J3 or better at near, demonstrating a range of vision without necessarily compromising image quality. And then looking at our monovision eyes, 100% of eyes targeted for near were able to see J2 or better. And that's with an average target of about a -1 diopter. So you don't really need very much anisometropia when you're targeting for monovision with this platform. So in this prospective case series, the Envista Toric lens was predictable, rotationally stable, and very effective in reducing refractive astigmatism. And despite having an essentially plano refraction postoperatively with a monofocal lens, patients had a surprising amount of intermediate and near vision. And this is thought to be due to its aspheric optics with zero asphericity.
And what's the take-home message?
Well, I think that this, like I said, I think this is an excellent platform to use for your astigmatic patients. I know Bausch & Lomb cannot market this as a multifocal lens or an accommodative lens, but for patients that may want good quality vision and possibly reduce their dependence on corrective lenses, I think this is an excellent option.
Thanks for listening to this episode of the iPod from Ophthalmology Times. We hope you subscribe at iTunes and let us know what topics you'd like to hear more about. Stay connected by going to ophthalmologytimes.com, subscribing to our newsletter, and following us on Twitter, Facebook, or Instagram. We'll see you next time.